That's Carla.
You have 3 minutes.
Taoiseach, I know this was mentioned yesterday in the Chamber in relation to Lindara in Cherry Orchard and about 11 beds being closed. But Taoiseach, I'd like to say this is basically the tip of the iceberg when it comes to staff shortages. And I'll just list out a list of theatres around this country where there has been closures because of staff shortages, and it's a symptom of something else. So here's the list. Our Lady's Hospital, Crumlin, there were 2 full theatres closures over a 6-year period due to staff shortages. Temple Street Hospital, 1 theatre closure for the same reason. Theatres closures were reported in all constituency hospitals at the Dublin Midlands Hospital Group. At St James's Hospital, there were 2 to 3 theatres closed per day, depending on nurse shortages on the rota. In Luke's Hospital, Kilkenny, elective theatre closed because of staff shortages, and a new theatre that has opened in Wexford General Hospital due to difficulty in securing specialty theatre nurse and staff shortages. So, Taoiseach, this is a symptom of something much bigger, and that bigger is pay and conditions for nurses. Taoiseach, I also like to get on to something more is equally as crucial, and nobody has kind of picked up in the Chamber this week. There's a report in the Irish Times this week in relation to assessments for mental health for young people in this country, and it's quite damning. And I read it out. There are 2,500 children and young people on waiting lists for initial assessments of mental health services in 2011, an increase of 44% on the same period last year, according to the HSE. Bernardo's said this is bringing long-term unnecessary consequences on children, affecting every aspect of their development. They also go on to say it found almost 60% have been waiting for more than a year, while a quarter, 26%, have been waiting for more than 2 years for initial appointment. Taoiseach, I just find this quite incredible, where you have the reason why Lindara the shortage of nurses is because nurses are emigrating for better pay and conditions in this country. And the past year has seen systematic cuts to their conditions and pay. And we are living now not only in a 2-tier health system, but a 2-tier paid system where nurses, medical professions are actually going to the private sector rather than the public sector. And Taoiseach, I'd like to say, the mantra of Fine Gael over the last 6 years is to create the conditions for growth and prosperity. But Taoiseach, your party and you have created the conditions for this crisis. And I think, fundamentally, Taoiseach, I think you're a decent man, a very decent man, I think. But how can you, after 6 years, turn around and finish as Taoiseach and hold your head high and say that in your tenure as Taoiseach that this was a success? I would actually find that embarrassing. Embarrassing to be a member of the party of you're in and a member of the citizens in this country. So how can you justify them cuts and them shortages in this country?
Sir Deputy, well, you're a decent man too, and I respect your right to raise any issues that you feel strongly about in the House here. But I think you should understand that when this government and its predecessor were elected, we were blocked out of all the international markets. Interest yields were 15%. Unemployment was at 15.2%. We were hemorrhaging jobs by the 10,000, and there was despair and disillusionment all over the place. Now, because of the sacrifices of the people, that situation has changed very much. You're now able to borrow money for the state at less than 1%. Unemployment is down to 6.3, 6.4, heading in the right direction. Over 225,000 new jobs have been created since Minister Bruton brought in the first action plan for jobs. Now, you talk about recruitment of nursing, and Minister Harris has addressed this on a number of occasions. Incentives are there now for nurses. Permanent contracts are offered to all new nurses coming out of highly specialised training here in Ireland, and there are opportunities for nurses to return home to work in the hospital service here in Ireland. Not everybody will do that. Young people tend to move to other countries in all walks of life for experience and travel and to develop their skills. Minister McEntee has been working very hard on the question of mental health. She was out yesterday in Lindara, where there are only half of the 22 beds that are occupied. Now, she was given assurances yesterday on her visit that any patients discharged from the Lindara are children who are discharged for clinical reasons only. And the HSE have confirmed to the Minister that no young person will be discharged unless deemed clinically appropriate by their mental health team, and nobody is being discharged in order to allow a bed to be closed. The HSE have also assured the Minister that for patients who are discharged for clinical reasons, dedicated follow-on support is available for them from the community-based child and adolescent mental health services, and they will continue to be provided as is required on a routine basis. And the Health Service Executive will also increase the capacity of the Child and Adolescent Mental Health Day services during the summer to enhance the level of support available for those children and for their families. And the core issue facing Lindara, Deputy Kenny, relates specifically to staff recruitment difficulties for mental health professionals, which unfortunately, as you point out, reflects wider health system recruitment and retention issues. And let me assure you that the problem facing Lindara does not relate to funding availability, but to staffing availability. So there are intensive efforts underway now to increase staffing, to allow more beds to be reallocated, and the HSE is currently actively engaged in a recruitment process. In fact, a number of staff are due to join the service there in the near future, so I hope that will improve things. And finally, to point out to you, Deputy Kenny, that there are now an allocation of $14.5 billion going into the health services here, and all nurses coming out of Irish training institutions are now offered permanent contracts, which gives them the opportunity to work at home here in our own hospitals.
Deputy Kenny, final supplementary.
Taoiseach, I mean, that sounds all well and good, but there seems to be a perennial problem in this country. We go from crisis to crisis with the health service. I mean, it's not rocket science. You know, in a country where there's a lot of money swashing around, we should have a health system that works for everybody, regardless if you're a millionaire or unemployed. That's the way it should work, and nobody should have to wait 2 years for any sort of assessment, and I think it's a disgrace. Taoiseach, I think what it comes down to, Lindara and all the closures, it comes down to not paying nurses properly. The last 7 or 8 years have taken a toll on nursing and public sector workers in this country, where they're demoralised, where they have to work an extra hour per week to just make ends meet. So this is the fundamental problem, Taoiseach. And I think outside Cherry Orchard, and this Friday is going to be a protest because of the cutbacks at 4 o'clock outside. But Taoiseach, another thing about public sector pay, and I don't want to make it personal, because I think you don't want to. Sometimes I try to differentiate the personal and political. But Taoiseach, you're going to walk away with a massive pension in 2 weeks' time, a golden handshake, and a pension of €150,000. Now, I know most people are listening in here will be quite nauseated when they hear that. And I think this is the kind of the two-tier system that we have in this country, where politicians go off in the sunshine with huge amounts of golden handshakes and make big money. So, Taoiseach, I say again, are you not ashamed of what you've left behind?
Deputy Taoiseach, final response.
I'm very proud of the people of the country for the way they have responded to an unprecedented economic crisis in this country that has made us the envy of many in Europe, and that has left our country the fastest growing economy in the European Union for the last 4 years running now.
Deputy Kenny.
I admit, Deputy
Kenny, please.
I admit that we have many challenges up ahead. But believe me, the changes that have been brought about have put our country in a much safer position than it was. And no doubt you have spoken to many people, many of your constituents, who have had experience of having treatment inside the health service of our country, and they will have nothing but praise for the doctors and the nurses and the attendants who look after them. The problem has always been to get into the system and have the capacity to deal with that. And that's why government treats it as a priority. That's why $14.5 billion is allocated, and that's why changes are constantly being made through primary care centres, home care packages, community care teams to look after people. So, in respect of the payment situation you make for nurses, The same arguments are always made for Gardaí, for Defence Forces, for teachers, for public service and so on. And those talks are now beginning in full with the officials from the Department of Public Expenditure and Reform and the trades unions, and the Minister hopes to engage intensively in that now with a view to having it finished by the end of June of this year, for an extension of the Lansdowne Road Agreement, where benefits were won and benefits were agreed with the unions involved. In respect of your other matter about pensions, when I leave this seat here, I will continue to be paid as a backbench deputy.
Now, that completes